If you are a medical student or a cardiology resident, one of the important cardiovascular diseases is constrictive pericarditis. Stay with me until the end of this video so I can fully explain its physical examination. The first part is general appearance. Since constrictive pericarditis, or CP, is a chronic disease and cardiac output is reduced, most patients experience weakness and fatigue. And in the physical exam, muscle wasting and cachexia are clearly evident. In a patient with constrictive pericarditis, or CP, the pericardium is completely thickened and stiff, and in most cases, there is also calcification. So it's like an iron cage surrounding the heart. The ventricles don't have any problems during systole because they contract and pump the blood out. But during diastole, when filling is supposed to happen and blood should enter the ventricles, this issue causes a problem. In other words, during the diastolic phase, when blood is supposed to enter the ventricles, this thick and stiff wall doesn't allow the ventricles to expand. Therefore, during diastole, not enough blood enters the ventricles, and as a result, the ventricular output is also reduced. Most of these patients have low blood pressure along with weakness and fatigue. When blood cannot easily enter the right ventricle during diastole, this blood backs up and enters the IVC and SVC. The blood that enters the IVC accumulates in the liver and leads to hepatomegaly. That's why in CP patients, on inspection and palpation, you can find hepatosplenomegaly, abdominal distension, and edema of the lower limbs. And as we mentioned, when blood can't easily enter the right side of the heart during diastole, this blood backs up and returns entering the JVP. Therefore, CP patients have JVP distension. This is a JVP curve in a normal individual. In a person who develops CP or constrictive pericarditis, we have steep X descent and Y descent. In other words, it becomes similar to an M or W, which is called the M or W pattern. Now, what is the reason for the increased slope of the X and Y waves? In a patient with CP or constrictive pericarditis, because the cardiac output decreases, the right atrium generates stronger contractions in order to increase blood flow and preload as much as possible. For this reason, since the contraction of the right atrium has increased, its relaxation will also be greater, and the negative pressure created in the right atrium causes the X wave, which is a result of atrial relaxation, to become more pronounced and its slope to increase. What is the reason for the steep Y descent? Because the right ventricle cannot expand sufficiently during diastole and maintain cardiac output. Therefore, it generates stronger contractions. And for this reason, during the diastolic phase, when the tricuspid valve opens, a suction effect occurs that causes the slope of the Y wave to increase. That's why in these patients we see a steep Y descent. The next part is blood pressure. Blood pressure in patients with constrictive pericarditis is often low, and these patients tend to be hypotensive. The next part is the arterial pulse. In patients with CP, the pulses are usually weak and thready, and some patients also have a paradoxical pulse. How do heart sounds change in a patient with constrictive pericarditis? An extra sound is heard called a pericardial knock in a patient with CP right at the beginning of diastole. As soon as the tricuspid valve opens, blood flows from the right atrium into the right ventricle, and the RV exception occurs. That's why the free wall of the right ventricle strikes this stiff and calcified pericardium, leading to the pericardial knock being heard. So the pericardial knock is a diastolic sound that is heard during the diastolic phase, that is immediately after S2. The last part is the heart murmur, which in patients with constrictive pericarditis, no additional murmur is heard. If you have found this video helpful so far, please like it and share it with your friends. And if you don't want to miss my next videos, please subscribe,